Recording. Okay, now we're recording. Thank you for the vote of confidence, but no, I'm sucking right now. That's okay. Exam 3 is going to be on, it's going to open up on Thursday at 8 a.m. and it will close Friday night, May 1st. Now, what I do encourage, though, is that you not wait to the last minute to do your exam. My hybrid class had their exam last week, and a couple of students had some technical issues, and so I had to like reopen the exam going into Saturday, which sucks for them as well as for me. So if you could, like, maybe the latest Friday afternoon, early Friday afternoon. Therefore, if something screws up or whatever, I'm able to address it, and everyone's able to complete their exam in that window. All right, but technically you have until Friday at midnight to complete that exam. Now, what that exam will cover will be the muscular system, because typically that's on the second exam, but we didn't get to it before spring break. So the muscular system will be on this exam, as well as the endocrine system, blood, and the cardiovascular system, which we're finishing now. It will not include the nervous system. The nervous system was on the previous exam to answer Emily's question. Now, the format will be as follows. It will be half true and false, half multiple choice, and the true and false will just be straight out true and false. There'll be no filling in the, changing the bold underlined word if it's false, because there's just really no easy way to do that online. So there'll be 25 true false questions, 25 multiple choice questions. And what I do is I split the exam into 2 parts, so you don't have to sit for a full hour to take this exam. You take half of the exam, and then you can go like rest, walk around the block, whatever you want to do to sort of de-stress or whatever, and then and it'll be 25 minutes. It's a minute per each question, and then you can come back and complete the second one. It doesn't matter which half you do first. They're not sequential. It's just half are in one, half are in the other. The questions will be displayed one at a time, and you will not be able to backtrack. So once you submit your answer, it's submitted and you cannot go back. Okay, I think that's how your practical was as well. So now my guess is that the true false questions don't take a full minute to complete, so you'll have more than a minute that you can allot to your multiple choice questions. Okay, so that's exam 3. Take-home exam. Many of you have been asking about take-home exam. When is the take-home exam going to be available? Well, I just posted it this morning. It is in the assignments folder where all of your other quizzes and exams are. Now, typically with your quizzes and your exam, you can only go in once. You go in, you have to complete it because once you come out, it's automatically submitted. That is not the case with the take-home exam. You can go in and you can enter your answers, and then you can save those answers and leave. You can come back, change those answers, what have you. You can enter and exit that exam as often as you like. However, you don't want to submit your answers until you are completely done with them, because if you submit half your answers or most of your answers or whatever, and then you submit it, if you want to go and add later, or if you want to change your answers, you have to go through and do your whole exam again, and you don't want to do that. Yes, the questions are the exact same as what I gave you in a handout. So all you have to do is go in and just enter make your selections, A, C, D, what have you. But it's the same order, it's the same questions. The only thing that's changed is how you submit them. Originally you'd get by Scantron, which you physically hand to me. Now you'll just be doing it online. Now, if you want to, what you can do is you can put all your answers in and you can submit, and it'll tell you what your grade is. And if you want to then let me try to let me see if I can get that grade even higher, and you want to try to figure out, well, which ones might you have missed, and then change those and then submit again, you can do that. A lot of work, because you got to go in and key in it all 100 again, but you can do that. And multiple submissions, it'll take your highest grade. So if you go in and you submit it once and you're like, oh, I got an 85, and then you went and changed it, change some answers, whatever, and submit it again, and your grade was actually lower, that is, you changed some right grades to some wrong grades, it would still take your highest grade. Okay, my suggestion is that you make sure that you only submit once and that you get with other people in class, you compare your answers to make sure that you have answered the questions to the best of your ability, and you only submit it once and then you're done. Okay. Nevertheless, it is due Friday, May 8th at midnight, and I am making that a pretty hard deadline, right? So don't wait till the last minute and then have technical issues, all right? Don't wait till Friday at 11 o'clock to start keying in your answers. That's dumb, okay? You have plenty of time. This is a week later than the original due date, okay? Alrighty, so we finished talking about cardiac output on Friday, and I rated everything to this equation, which was cardiac output is heart rate times stroke volume. And I said to really understand cardiac output, you needed to commit that equation to memory, and you needed to understand all the different factors that affect heart rate and all the different factors that affect stroke volume, because those factors would affect cardiac output. And you can see that in this figure here from your book, all these different factors that affect cardiac output, they either affect heart rate and or affect stroke volume. And I also gave you, I emailed you a little learning activity for you to complete, and I want to go over that right now. So this is the learning activity, and here are the learning objectives that this learning activity was to help you understand, or I should say help you achieve, right? You should be able to write the equation of cardiac output, explain factors that affect heart rate, explain the factors that affect stroke volume, explain why people who engage in aerobic exercise regularly have lower resting heart rates than people who do not. Okay, so let me move to a slightly different format so I can actually text this. Okay, so we know that you should have committed this to memory, but what's our equation for cardiac output? Cardiac output equals stroke volume times heart rate. And of course, stroke volume is, oh, did that stop sharing? Yeah, it did. Hold on a second. I just noticed that it stopped sharing, so let's go back to that. Okay. Share, you stupid computer. All right, it's sharing again. All right, cool. So our equation for cardiac output is cardiac output equals stroke volume times heart rate, okay, where stroke volume is the amount of blood in milliliters that leaves the ventricle with every beat, and heart rate is, of course, the number of beats per minute. Next question was, as preload increases, how is stroke volume affected? And therefore, how is cardiac output affected? Okay, so first of all, I'm going to ask this question, but I want you to answer it to yourselves. I don't actually want you to, unmute your mic or whatever. But okay, I want you to think about a second. What is preload? What is preload? Well, preload is the basically the blood in the ventricle. Why is that giving me a plus? Yeah, blood in the ventricle prior to systole. So in other words, it's the amount of blood that's in the ventricle right before it contracts. It's also referred to as the end diastolic volume. At the end of diastole, when the ventricle is finished its relaxation phase, right before it contracts, right? That's what the preload is. Okay. And the greater the preload, the amount of blood in the ventricle, how does that affect stroke volume? So in other words, as the preload increases and decreases, as the amount of blood in the ventricle at the end of diastole increases and decreases. How does that affect cardiac output? Specifically, I asked, as the preload increases, how does that affect stroke volume? Well, as the preload increases, that causes the stroke volume to increase. And if the stroke volume will increase, that will also cause the cardiac output to increase, right? Because cardiac output equals stroke volume times heart rate. So as the stroke volume increases, cardiac output increases, okay? Now, what are some of the things that can increase your end diastolic volume, right? Well, the big one is venous return. That is the amount of blood that's returning to the heart from the veins. As that increases your preload, and that's going to increase stroke volume. Okay, so let's stop me. Raise your hand if you have any questions about this as we're going along. Okay. So assuming that there are no questions there, let's go to this table down here where we're going to fill in this information. All right. So what I was trying to accomplish through having you complete this table is look at, hey, what are all the different factors that can affect stroke volume? How do they affect stroke volume? And how will they affect cardiac output? Okay. So let's go through these here. First is the hemorrhage. Well, what is hemorrhage? Hemorrhage is loss of blood. So like if you're cut and you bleed, that's hemorrhage. Okay? So if you're cut and you lose blood, how is that going to affect your stroke volume? Well, any blood that's lost from your cardiovascular system is not going back to the heart, right? So that's going to cause a decrease in stroke volume. I can't do an arrow here. So I'm just going to put a D for decrease, right? So I'm going to put a smaller D for decrease. All right, so it's going to decrease stroke volume, and if it decreases stroke volume, it's going to do what to cardiac output? It's going to decrease cardiac output, of course. All right, what about dehydration? Well, with dehydration, you are losing water from your blood. And if there's a decrease in blood volume, that's going to decrease the amount of blood that your ventricles are pumping. And that is going to also decrease stroke volume and therefore decrease cardiac output. In fact, the biggest issue, the biggest threat of dehydration is with a decrease in stroke volume, your heart literally can't maintain enough blood pressure to keep all of your vital organs supplied with blood and therefore oxygen. All right, what about if you had a blockage in a major vein? So let's say there was a blockage in the inferior vena cava, so there's a decrease in blood flow back to the heart. Well, a decrease in blood flow back to the heart is going to decrease the preload. It's going to decrease the amount of blood that enters the ventricles prior to systole or contraction, so that's going to lead to a decrease in stroke volume, which is going to lead to a decrease in cardiac output. Substances that open calcium channels. Well, why are calcium channels important? Well, they're important because calcium is needed to open those binding sites for myosin. So if they open those binding sites for myosin, then you're going to have more myosin heads binding the actin filaments in cardiac muscle cells, and that's going to cause the cardiac muscle cells to contract harder, and that's going to drive more blood out of the ventricle. So that's going to increase stroke volume, which is going to lead to an increase in cardiac output. Remember that cardiac muscle cells get about 10 to 20% of their calcium from the extracellular fluid. This wouldn't really affect skeletal muscles, for example, but it will affect cardiac muscles. And of course, what if we administered a substance to a patient that blocked those or closed calcium channels? Well, we'd have the opposite effect. If we close those calcium channels, then there'd be fewer myosin binding sites available, so the heart wouldn't, the cardiac muscle cells wouldn't contract as hard, so that would decrease stroke volume, and of course that would decrease cardiac output. Vasodilation of veins. Vasodilation of veins. So if the veins increased in diameter, what would that do to venous return? Well, that would increase venous return, right? If the veins dilated, they become bigger, then that's going to increase the amount of blood that returns to the heart, increasing venous return, and that's going to increase stroke volume and increase cardiac output. And of course, vasodilation is going to increase venous return. Then of course, vasoconstriction, them getting smaller, is going to decrease venous return, which is going to lead to a decrease in cardiac output. Okay, now hopefully you did this over the weekend as I asked you to, and you had these answers, and you're not just filling this in as I've done this, as I've shared this with you, right? And if you, if you got any wrong, right, you understand why you got them wrong, and those of you that you got right, or maybe you were sort of shaky, like I think this is right, but I'm not sure, you've been confirmed that you're right. So are there any questions about any of this? This really, if you understand these different factors and how they affect stroke volume, and therefore how they affect cardiac output, right, you're pretty much going to be able to answer any question I throw at you about the different factors that can affect cardiac output. Stroke heart rate is, pretty much intuitive, right? The more times your heart beats, that's going to cause an increase in cardiac output. Stroke volume, it tends to be a more difficult concept for students to understand, and so that's why I wanted to focus on that. So questions about any of these factors and how they affect stroke volume? Okay, let's go to the second page of your learning activity, and I apologize that this is looking sort of small, but again, you should have this in front of you. I'll blow it up. I just can't edit it in this form. But it says John and Stephanie are sitting at a table enjoying a cup of coffee. Stephanie runs 3 miles each day. John does not engage in any aerobic exercise on a regular basis. Right? We'll get to blood pressure a little later. John does not engage in any big exercise on a regular basis. If they both have a resting cardiac output of 5,250 milliliters per minute, what explains why John's heart is beating at 78 beats per minute, while Stephanie's heart is beating at only 60 beats per minute? Use the equation for cardiac output to explain your answer. Okay, anybody want to take a stab at this? I'll open the floor up for this one. You can raise your hand. Let me recognize you. Oops, sorry. Let me see if I can. Okay. All right. So Emily says John has a larger stroke volume. Now, do you mean John or do you mean Stephanie? Because so they both have a resting. I'm sorry. They both have a cardiac output of. Let's see here. 5,280 equals stroke volume times heart rate. Okay. Let's do John. And let's do Stephanie. All right. So they both have a cardiac output of 5,280. It doesn't matter what their physical condition is, because when they are, just sitting a cup of coffee, their tissues have the same requirement for cardiac output, right? However, John's heart is beating 78 beats a minute, so we'll sub that in for him. And Stephanie's is beating 60 beats per minute. Okay. Right? So now, you of course know that people who engage in aerobic exercise regularly have a lower resting heart rate, and this is getting to the why that is, right? John is sedentary. Stephanie runs. Her resting heart rate is 60. His is 78. If their tissues both need basically the same amount of oxygen when they're at rest, same amount of blood when they're at rest, what explains the difference in heart rate is that Stephanie has a higher stroke volume. So if we take 5280 and then we divide it by 60, we find that every time her heart beats, it delivers 88 milliliters. We'll say milliliters per beat. All right, this is beats per minute, right? John, if we do the math again, 5280 should be it actually should be 5250, but it should be 5250. I'm thinking of the number of feet in a mile, which is 5,280. So 5,250 divided by 60, right? So it's roughly the same, 88 milliliters per beat. And for John, 5,250 divided by 78, right, is 67 milliliters per beat. Okay, and just so I am clear, right? No, I am not going to have you calculate stroke volume or beats per minute, heart rate, or cardiac output, right? So you don't have to worry about. I'm not going to have anything like this on the exam. However, this exercise was just so you understand. Well, how is it that someone who engages in aerobic exercise has a lower rate, right? And it's explained by this equation. People who engage in aerobic activity, their hearts are able to move more blood every time they beat. If the requirement of cardiac output is 5,250 for two individuals, the individual who has a higher stroke volume because they do aerobic activity is going to have a lower resting heart rate. Okay, and that was one of your learning objectives. Explain why people who engage in aerobic exercise regularly have lower resting heart rates than people who do not, right? So this exercise that I gave you was designed to help you understand that learning objective. Okay, are there any questions before we move on to the next topic, which will be blood pressure? Okay, so the next topic on your slides covers blood vessels. However, I put this lecture online. It's pretty self-explanatory, or I should say the concepts aren't very difficult. These are the learning objectives: contrast the structure and function of arteries, veins, and capillaries, explain vasoconstriction and vasodilation and their effects on blood flow and pressure, describe the two pathways of blood flow through capillaries from arterial to venule, explain how the respiratory pump, skeletal muscles, and valves help move blood through veins. So those are the learning objectives Again, I placed this on a YouTube video, which is available on Blackboard, and I also emailed this YouTube video out to everyone. So hopefully you have a chance to to watch that video and write down any questions that you have. So let me open up the floor right now for questions about this. I asked you to watch this over the weekend, and I said be prepared for um, um, to ask questions about it. So any questions at this time? Well, let me ask you a couple of questions. Which blood vessel has a thicker wall? Raise your hand for that. Which blood vessel has the thickest wall? Arteries, veins, or capillaries? Raise your hand to answer. All right, Sandy, you can.
Arteries?
Arteries, very good. Arteries have the thickest wall. It's mainly due to the tunica media. It has a very thick layer of smooth muscles. Also, arteries have to deal with high blood pressure coming off of the out of the ventricles. The veins do not. Okay. All right. Cool. Another question: do all of the arteries, excuse me, do all of the blood vessels have three tunics? Do all of the blood vessels have three tunics? The tunics. All right. Oh, Emily.
I don't think capillaries do.
You are correct.
Yeah.
So arteries and veins both have three tunics, the tunica intima, the tunica media, and the tunica externa. The capillaries only have one. Remember, they have to be very thin to allow for the movement of substances across their wall. So they really don't have essentially like a tunica intima, which is basically a single layer of simple squamous epithelial cells and a basement membrane. Okay, all right, cool. So if there are no more questions, well, if there aren't any questions, then I'll move on to the next topic, which is blood pressure. Very important topic. So here are your learning objectives. Explain how the heart moves blood through. Okay, that is, okay, yes, that's true. All right, I thought maybe I was in the wrong spot. Explain how it moves blood through the vasculature. Define systolic, diastolic, and mean arterial pressure. Describe pulse pressure or pulse. Describe the pressure of blood as it passes through the systemic circulation. And use an equation to explain how the nervous system, diuresis, and changes in the lining of blood vessels can affect blood pressure. Alrighty, so first and foremost, I want you to understand that the heart doesn't actually pump blood all the way through the cardiovascular system. And we know that this is the case because if it literally pushed blood through the entire cardiovascular system, those thin capillaries would rupture. They would literally blow out. Also, what would happen is blood would only move when the heart contracted. Every time the heart relaxed, blood would stop flowing. And that's not how blood moves. Blood continuously moves, even when the ventricles are relaxing. Instead, what the heart actually does is it establishes a pressure gradient. A gradient, if you recall, is a difference in some factor from one point to another. So basically, it creates a pressure gradient, high pressure in the arteries coming out of the ventricles, low pressure in the veins, and so blood moves from high pressure to low pressure. The ventricles contract and move blood into the arteries, and then the arteries sort of stretch out and act like a bellows. And if you're not sure what a bellows is, a bellows used to be used to stoke a fire. You open it, it has this bladder that expands, and you open it to suck in air, and then you close it to push air out to stoke a fire. And so your arteries sort of act like a bellows. When the ventricles contract, they stretch, and then when the ventricles relax, they recoil. And while the ventricles are relaxing and they're recoiling, the arteries, excuse me, the arteries are recoiling, and that helps keep blood flowing. Let's define a couple of pressures. Systolic pressure is the peak pressure that occurs in the aorta and other large arteries during ventricular systole. So when the ventricles are at peak contraction, the blood pressure taken in your major arteries, that is systolic pressure. Diastolic pressure is the lowest pressure in the aorta and other large vessels, other large arteries rather, during ventricular diastole. So systolic is peak pressure. The diastolic pressure is the minimum pressure. And to calculate, to know what the mean pressure is that the arteries are exposed to, that would be the mean arterial pressure, which is an average of systolic and diastolic. Mean arterial pressure in general is required to be 60 millimeters of mercury or higher in order to maintain blood flow to organs. If it falls below 60, then the individual is risking to going into shock. Your pulse. Many of you have taken your pulse before, and what you're actually feeling there is what's called pulse pressure. And it's basically the difference between your systolic and your diastolic blood pressure. It's a little pressure wave that's created in your arteries as your ventricles contract and relax. And you can feel your pulse in arteries that are very superficial, and we call these pressure points, and they're in various locations throughout the body. You have several in the neck and head region. The most common one is taken in the radial artery here, right? However, sometimes when you're doing CPR, you're taught to take the carotid pulse because it's a very strong pulse coming right from the heart. Several years ago, I had a very bad laceration to my left leg, and I had to go to the ER at St. Mary's. And when I came in, one of the first things that the attending physician did was he took my posterior tibial artery pulse because he wanted to make sure that there was pressure there and that I hadn't broken an artery, and just wanted to make sure that there was blood flowing to my foot. And luckily, I had only cut a vein, and so I was in good shape. But these are all called referred to as pressure points because they can be pressure can be applied to them to reduce blood flow to a portion of the to one of the limbs in the case of so say a severe laceration where you want to stop bleeding. Okay, as I stated, the carotid artery, the carotid pulse is another commonly used pressure point for monitoring pulse. So this figure here shows the pressure in various blood vessels as we moving away from the ventricles. So the aorta, of course, comes right off the ventricles, and then as we move farther and farther away from the ventricles, going all the way to the vena cava, notice what happens to pressure. It is highest on those major arteries, and that is why we always take blood pressure in major arteries, right? Not veins or capillaries or even smaller arteries, right? Because blood pressure falls the farther away we get from the ventricle. So that's why we always measure blood pressure in major arteries. And notice that you see the pulse and you see this difference in systolic pressure and diastolic pressure only in your major arteries, maybe some of your arterioles. Also notice that the farther we get away from the heart, the farther we get away from the ventricles, the lower the blood pressure, right? In fact, down in your veins, there is very little pressure gradient driving blood, which is why you have to have those features that you hopefully learned about from my video on, like the valves and the respiratory pumps, um, and and the milking of the veins by skeletal muscles to keep blood moving through the veins. If you don't know what I'm talking about, then make sure you look at that lecture that I completed on blood vessels. But anyway, notice that as we move farther and farther away from the ventricles, blood pressure decreases. And the question I have, why would that be the case? Why would blood pressure fall as we go from the aorta to the arteries, to the arterioles, to the capillaries, so forth and so on? Anyone have any idea? Let me help you out by first making sure we understand what pressure is. Pressure is force over area. Okay, force over area. So one of these things has to be changing as we move farther and farther away from the ventricles. Either force is increasing, or the area that that force is applied to is increasing. Which do you think it is and why? Anyone have any ideas on that? Well, force isn't changing because the force is being produced by the ventricles, right? And the amount of force that the ventricles produce is not going to change as we move farther and farther away from the ventricles. What's happening is the area is changing. So we start off with the aorta, which is one big blood vessel, but then it splits into smaller blood vessels, which then split into smaller arteries. And when you get to the arterioles, you're talking thousands and thousands of blood vessels. And so the force that's produced by the ventricles is being applied to a greater and greater surface area. And so that's why pressure is decreasing as we move farther and farther away from the ventricles. There's a greater surface area that force is applied to. So your arterial pulse, blood pressure, those are part of all vital signs, which are used to assess the efficiency of your cardiovascular system. Blood pressure and pulse, along with your temperature and your respiration rate, are typically taken to make sure that you are that your cardiovascular system is stable, right? Those are the first things when you go to the emergency room. They always check those vital signs first, and if those are in the normal range, then you're okay to sit and wait to be seen by a physician. Okay, let's talk more about blood pressure. Blood pressure is extremely important. It's tightly regulated. If blood pressure is too low, your tissues can die due to lack of blood and oxygen. If blood flow is too high, then it actually damages blood vessels, and that could lead to damage to your organs. It can also lead to a weakening in the walls of blood vessels, which is called an aneurysm, which can have other consequences. Blood pressure is simply the pressure that the blood exerts along the walls of blood vessels, and really we only measure blood pressure in the arteries, because those are large arteries, because as you saw, blood pressure drops as we move farther and farther away from the heart. So when we talk about blood pressure, we're really talking about large arteries. So it's the pressure exerted against the walls of large arteries. Now, blood pressure is directly related to cardiac output, and right, that should be intuitive. The more blood you have in your arteries, the greater the force they're going to exert against the walls of those arteries. But another component of blood pressure is PR, or peripheral resistance, and that is the force or the resistance against which your ventricles have to pump blood. So blood pressure is simply cardiac output times peripheral resistance. And I really love this figure. This figure came from another book, but I loved it so much that I use it to teach the concept of blood pressure. And it's going to basically illustrate the different components of this equation. So blood pressure is going to be the pressure that's being exerted against the walls of the artery. And this sort of like bladder looking area here represents your large arteries with blood pushing against the walls of that artery. What's the blood filling those arteries is cardiac output, right? The ventricles pump blood into the artery. So this represents cardiac output. Blood leaves your arteries through the arterioles, and your arterioles are very small. They're very small, and they actually are responsible for most of the peripheral resistance. Not all, but most of the peripheral resistance. So this portion of this figure represents the peripheral resistance. And you can see here that, hey, the greater the cardiac output, the more blood you're going to have here in the arteries exerting a force against the walls of the artery. And the greater the peripheral resistance, that is the less the smaller the amount of blood that leaves the arteries, the greater the blood pressure is going to be as well. So I really love this figure. I think it does a great job of illustrating the factors that affect blood pressure. Right? So this slide here shows two different situations with respect to blood pressure. Here at the top, we have low blood pressure. What would cause low blood pressure? Well, if we have low cardiac output, and we have low peripheral resistance, right? We would have less blood in the arteries exerting pressure against the walls of the arteries. If, on the other hand, we increased cardiac output, so we have more blood entering the arteries, and we have a greater resistance to blood leaving those arteries, that would lead to an increase in the amount of blood exerting a force against the walls of the arteries. So that would increase blood pressure. So let's look now at the different factors that can affect blood pressure. And any factor that can affect cardiac output, peripheral resistance, is going to have an effect on cardiac output. So let's first look at the influence of the nervous system, specifically the sympathetic and parasympathetic nervous system. Well, the sympathetic nervous system is going to increase heart rate. It's also going to cause vasoconstriction. So the sympathetic nervous system is going to tend to increase cardiac output. The parasympathetic nervous system will tend to decrease heart rate and decrease, increase blood flow to non-vital tissues such as the skin and muscles. Okay? Any substance also that affects vasoconstriction and vasodilation is going to increase peripheral resistance. For example, nicotine increases blood pressure. How does it do that? It actually causes your blood vessels to vasoconstrict. That increases peripheral resistance. Alcohol, on the other hand, lowers blood pressure by dilating blood vessels. Blood viscosity, and viscosity is basically thickness, increases peripheral resistance as well. So an increase in, say, your red blood cell count is going to increase the viscosity of your blood and can increase peripheral resistance. What about damage to the lining of blood vessels? So I have mentioned, if you recall, that the cells that line your blood vessels are very, very low in terms of friction. They're a low friction surface. They're very, very smooth and very, very slick, if I may use that term. And that's so they can provide the lowest amount of peripheral resistance to blood flow. Think of a carpet. If you wanted to drag something across the carpet, which would provide the least amount of resistance to dragging across the carpet? Like Berber carpet that's not very thick, or like this real plush thick carpet? Well, a plush thick carpet, of course, is going to offer more resistance. Any alteration to your blood vessel will, the lining of your blood vessels will tend to increase peripheral resistance. If you have scar tissue, if you have a buildup of atherosclerotic plaques, like little fatty deposits, if you get calcium deposits into the walls of your blood vessels, which occurs with arterial sclerosis, any alteration from the normal anatomy of your blood vessels is going to increase peripheral resistance, and it's going to increase cardiac output. Okay. Also, I sort of alluded to this earlier, but the sympathetic and parasympathetic nervous systems are going to increase and decrease cardiac output respectively, because the sympathetic nervous system increases heart rate, parasympathetic decreases it. Diuresis will tend to decrease blood volume and cardiac output. Diuresis, remember, is production of urine. So ADH and aldosterone, those are those hormones that decrease diuresis, like when you're asleep or if you're not getting enough fluids, so that cardiac output doesn't drop to such a low level that your blood pressure drops too low. Okay. Other factors, such as like when you exercise, fever, and other chemicals can increase heart rate, and that will increase cardiac output and blood pressure. It is normal for blood pressure to increase when you exercise. That's one reason why you never want to walk up the steps in the to get a blood pressure check, because it just the action of walking up the steps will elevate your blood pressure. If you do that, you want to rest, sit down and rest a little bit before your blood pressure is checked. Fever will increase heart rate, which will also increase blood pressure, right? And there's certain chemicals that will do that as well. This figure right here is from your book, and again, like the figure for cardiac output, it does a great job of summarizing all the different factors that can affect blood pressure. And again, anything that affects blood pressure has to affect either cardiac output, peripheral resistance, or both. It all goes back to this equation right here. So I have run out of time, and I don't want to keep you any further. So this is what I want you to do. I want you to I want you to complete this learning activity before Wednesday. And on Wednesday, we will talk about how blood pressure is taken. And we'll talk a little bit about different factors that affect blood pressure. I don't, test on this content, but because blood pressure is something that hypertension is something that is so pervasive in our society, and so many people have high blood pressure and don't even know it, that I like to talk a little bit about that for the benefit of you, the student. And then we'll end by talking about capillary exchange. So capillary exchange will be the one topic from the cardiovascular system that we cover on Wednesday that's going to be on the exam. Also, before you leave, so be ready for that discussion about capillary exchange, and then we'll start the digestive system. So Melissa asked a question about a lab quiz. Is there a lab quiz? Yes, there is a lab quiz on on blood vessels and anatomy of the heart, and it will close Friday at midnight. And also you have a pre-lab covering the digestive system that will close on Friday at midnight as well. I neglected to mention that in my announcements at the beginning, and I apologize for that. Thank you very much, Melissa, for asking that question. Thank you very much, everyone. Have a great day. I will get an email out to you shortly with sort of a listing, as I've done everything that you should be working on this week. So look for that soon, and have a great day. I will be here for 10 more minutes to answer any specific questions